It's my pleasure to talk with you today. You and I met this year by connecting on WHO's work on supply chain commodities and my previous consultancy work on postpartum hemorrhage commodities. Your career began in Senegal as a pharmacist and supply chain officer before moving into HIV and nutrition programming with the World Food Program, consultancy work with Global Fund, and now more than 7 years with the WHO in West and Central Africa. Among these roles, you've worked at the intersection of essential medicine supply chains, HIV and TB programs, and broader systems strengthening to improve access and equity. Your regional perspective gives you a unique lens on how partnerships, supply chains, and cross-sector approaches shape health outcomes. I'm looking forward to learning from your experiences today.
Thank you. My pleasure, Lisa.
So, my first question for you. You began your career as a pharmacist and supply chain officer in Senegal, and now you serve as regional technical officer for WHO in West and Central Africa. What motivated you to move from pharmacy into broader public health systems work?
Yes, thank you so much, Larissa, and thank you for giving me this opportunity to really discuss that with you. And I have already, I would say that pharmacy was in my ADN. So my father was pharmacist as well. So I was so passionate by science of medicine and how they can heal and how they can change life. And early in my career, actually in Senegal, if you don't know, it's a low income countries, very poor country, actually full of debt, everything. So, but I realized something very frustrating in a low income setting is even when a medicine exists, it didn't really reach the patient. And that triggered me. I started at the Ministry of Health there in Senegal, and I realized that actually there are some innovations that exist in the world, and they were existing for more than 7 to 10 years, but they are not reaching outpatients. For example, for sickle cell diseases, there are actually technology outside, but we had so many children actually suffering from that, even dying prematurely because they couldn't have this. So my fascination around that came in the fact that I really wanted to understand what triggers this situation. Why this medicine exists, but we are still actually experiencing stock out, procurement delays, and weak system actually in the countries. And the only way for me to understand that was really to understand how health system work and how the public health system actually integrate medicine itself and its barrier. And understanding these barriers started was the beginning of my passion for public health oriented to supply chain in general. I wanted to understand why those gaps exist and how to fix them in a systematic level. And that curiosity definitely led me throughout many countries and diverse also institution and organization. And all of them is all my work has been always oriented towards access to medicine. And I found my passion not just in treating individual patients, but in strengthening the system that serve millions.
Mhm.
Thank you.
Thank you. That's something I didn't realize also before I learned about supply chain, that it is equivalent to medicine and healthcare and commodity access. It's not just getting
Sure.
something somewhere, but getting something to people who need it. So
That's
thank
true.
you. At World Food Program, you worked on HIV and nutrition programming. You've done so much. What did you learn about integrating HIV services with food security and nutrition? And why does this kind of cross-sector approach matter for health outcomes?
Yes, awesome. I think it's very important because many are struggling actually to make this interconnection. And I saw first how interconnected health and nutrition are. For someone living with HIV, access to treatment is essential. But so is having nutritious food to take those medicine every day. This is more important, especially because HIV actually weakens the system of individuals, and especially if you are in a low income countries, that's actually worsen the situation. The
Mm.
World Food Program is actually a humanitarian program first. They are firstly working with people in a difficult contexts, and you can imagine that people living with HIV, I was working with actually in the same situation and in the same context. So if a patient is angry or weak, adherence drops definitely, they are no longer actually in position of having or going and seek treatment or going or seek their medicine, and definitely outcomes suffer. That's just a logical system. So what I learned is that integration works when you link HIV care with nutrition and food security. And they are not just addressing one diseases. You are supporting a person's well-being in general. And it is that cross-sector collaboration, health, agriculture, social protections, access to medicines, that really make the difference. Thank you.
Yeah. And that leads perfectly to our next question. How do health programs in West and Central Africa address the dual challenges of HIV and malnutrition? What examples stood out to you as particularly effective or innovative?
Yes. Yes. Well, that's a great question, actually, because especially in West and Central Africa, uh, they it's a region that was left behind in terms of progress, definitely for HIV and for nutrition. And at some point, they had to come up with a catch-up plan to really catch the gap that exists between this specific region and the rest of the world. So HIV and malnutrition often coexist. So programs that bridge the two are the most effective. One example that stands out actually in my mind is in Cameroon, where locally produced fortified foods were used to support people living with HIV. And it's a great model for sustainability and ownership, not only because they were able actually to add access to the product and nutritious food that they needed, but because they were part of this. What WHO World Food Program was doing is actually working on HIV sensitive program and HIV also direct programming. It means that they will give you, first of all, the product that you need actually to have access to your product, to have very good health conditions. But secondly, also, they will help you in a sustainable way to continuously having access to this product by either producing by yourself or either offering you a social protection that will guarantee the access to this to the continuous supplies of this food. So I have also seen integration in maternal health clinics where women can access ART, nutrition counseling, and antenatal care in one place. And these are small shifts, but they transform patient definitely experience and outcome. And it's really about meeting people where they are and reducing the burden of fragmented services. Thank you.
Thanks. And for the students who might be listening, in case you don't know, ART is antiretroviral therapy, which is the therapy for people who have HIV or AIDS. So by providing nutrition services in places where women are going to give birth or get services related to birth, and those women may also have HIV or do HIV testing and could get medicine there. They're also getting nutrition there. So Aissatou is connecting all of this or giving an example of where these were all integrated together, just in case some people didn't know the acronym. So thank you. Okay, great. So next question I have is about health systems and supply chains. You've worked across pharmaceutical supply chains, tuberculosis, and HIV programs, and now WHO regional technical support. What are the most pressing challenges for ensuring reliable supply of essential medicines in West and Central Africa?
Yes. First of all, supply chain are the backbone of health system, yet they are often the weakest link. So the challenges range from fragmentation, procurement system. What is happening actually is procurement is donor driven in countries. So you can see that a program can be extremely well funded. For example, HIV, tuberculosis program are extremely well funded in countries. So they will benefit 100% of all supply chain means and procurement system, supply distribution, everything will be fine. And if you assess actually the availability of medicine, you will see that it's so awesome. It's 100% everything. But then in the back, you have some essential medicines that are left behind. And even maternals actually fail under these categories. And if you assess this availability now, you will find that, okay, for maternal health commodities, it will be 50% of availability in health facilities. And if you look at mental health, actually, it's 0% availability in many fatalities. And these donor-driven are unpredictable funding. Over the night, they can just cut the fund. And what will happen actually is countries are not really taking ownership of their own actually feature on supply chain. And is this funding drop, everything, the system itself will collapse. And it happens so many times. Too often, actually, countries rely on multiple parallel supply chain system driven by many projects. And at the end of the day, they don't really have national resources. They don't really have their own, the ownership of their own system. They don't really have domestic funding for that because it's all external. And I think that the future lies in coordination and regional solidarity, to be honest, because investing in a share system, digital visibility, and local production, so Africa can really rely less on imports, and imports not only of goods and commodities, but imports also of basic systems, root systems that really construct this supply chain. It's not easy, but I think that many progress are being made, and we are moving in that direction now. Thank you.
Thank you. It's so important. I think from my own public health, global health education, I just honestly don't think I ever learned about supply chain. Now that I've gotten into it through this research work I've done with on commodities, it's so obvious how critical and important it is. And at my own university now, where I'm teaching, University of Tennessee, they have a whole master's program in supply chain in the business
So,
school. I thought that
yeah,
was so great.
it is.
I think that, sometimes in education we get siloed so that supply chain becomes a business issue and people
Sure.
in public health don't even learn about it. So
Exactly.
you're bringing a lot of
So
exposure.
true.
Thank you. And then one more question on supply chain, and then we'll get into the regional partnerships, which you also already mentioned, or regional work. So one more question on supply chain. From your experience, how do weak supply chains impact equity in access to HIV, tuberculosis, and maternal health services?
Yes. From my experience, I can say that when supply chains fail, actually equity suffers. And I have seen that especially in rural area. Sometimes you land in a capital city where they have access, and even if they don't have access in the public sector, they have the alternative of using the private sector for it. This is why the standard methodology to measure availability and access is both in the public and private. But when you look at rural actually health center, you just learn that they don't have the same privilege actually. They can go actually months without key medicine.
Mm,
uh, One specific example that I had, and in my career, it's really something that till now I'm still discussing, that it was 10 years ago. I was in Mauritania and I was doing this assessment of the full pharmaceutical sectors. And then I realized that the capital city was so well served in everything, commodities, in system governance, every tools that you can imagine was there. But when I was progressing actually in rural area, I just realized that sometimes they have two boxes of medicine in a health facilities, and they don't even have a private actually pharmacies or even warehouse that are offering anything. And this is why I realized the full inequity in having access to medicine. And it's heartbreaking because the people in most remote areas are often those who need care the most. And a reliable supply chain is really a matter of justice. It decides
mm,
who gets treated and who doesn't. And
mm,
that's why I see supply chain work as not just technical, but
mm.
profoundly ethical. It's about fairness, dignity, and inclusion. You can manage to diagnose someone, but if you don't have medicine, they will never get the clinical outcome that you wish. And specifically in rural areas, that is worst actually. Thank
Hmm.
you.
Yeah, and this rural areas also are often called the last mile. So that's something
Sure,
that that terminology will bring into my class. So I want to add that here. The last mile, the rural area, the part that's farther from urban
sure,
areas with more accessibility.
sure, sure,
Yeah, thank
definitely.
you. Okay, now to regional and global partnerships. So, working at the regional level with WHO, how do you balance country specific needs with global guidelines? What strategies help align diverse stakeholders, governments, donors, and NGOs around shared priorities?
Um, Awesome. That's really awesome, especially in the point of balancing, because what I learned early in my career is the tendency of developing norms, standards, and also and just asking the country to just adopt and adapt. Adopt and adapt, it is something I really learned early. This standard, and till now I'm still keeping it as a motto also. So working at the regional level is always a balancing act.
Mm,
WHO provide global norms, but every country has its own realities. They have the resources, the human capacity, and the political priorities. And sometimes they are not willing to go beyond, even if they
mm,
can. Or sometimes if they are willing to go beyond, they cannot. That is a reality on ground. So my job is actually to bridge those words, to really create this balance, this bridge. And we start from the evidence, but we adapt. This is where
mm,
the adaptation part, and this is why I say that I was quite fascinated by that motto at the beginning, because I realized that not all norms and standards can be systematically adopted by the way that you think that, because of the reality I mentioned. So
mm,
I spend a lot of time listening to country, engaging in ministry, and co-creating solutions. So although they have, for example, if they need to have an integrated package at district level for some for bulk of medicine, how to actually co-create this solution to achieve this outcome, but based on the human resources that they have. Today, I cannot go in some countries and ask for them to use digital system, because if you go outside, actually in this rural area we mentioned earlier, they don't even have internet connection.
mm,
Just the way is it's to adapt by using the paper tools that they have, but the most important thing is for them to have the knowledge. And the most successful, I think, policies are the ones that countries truly own,
mm,
not just adopt because WHO say so, Global Fund say so, any other organizations, but because it fits to their context.
mm.
Thank you.
Yeah. And so you've mentioned several different agencies, and you have worked for both World Food Program and WHO, which are both UN agencies. I think that people who are unfamiliar with global health or who are just beginning to learn about global health might not realize that all the different UN agencies and other major donors and groups in this global health space work in very different ways, and at different sort of levels of impact. So, what insights have you gained about how partnerships across these different agencies can improve public health outcomes? We're really lucky to hear from you today since you've worked for two different ones.
Yes, yes, and thank you for asking that, because it's a really interesting how it's work. We tend to think that because it's UN, it's one model, but you realize working within this organization, but they are so different. And
Mm,
having worked with both WFP and WHO, I have seen how different UN agencies can complement each other's beautifully.
mm,
WFP, for example, the World Food Program, brings the incredible operational and logistic strength. They are
mm,
so operational on the ground and they know how to move things.
mm,
During Ebola response, they were the primary suppliers for all supply chain for essential medicines. And
mm.
it has
World
been
Food
the
Program.
case.
Oh, wow.
Yes, World Food Program, actually. They are the world leader for health supply chain in general. And during
Oh,
Ebola, it was so amazing how they were so quick in setting up, in distributing, in really organizing system. One actually, WHO brings the normative and technical guidance. Can you imagine combining normative and technical guidance to incredible operational excellence?
mm,
And when we combine those strengths, we move from policy to practice. For example, in joint work on supply chain or health product access, WHO can set the standard while World Food Program ensure implementation that the implementations reaches communities. And the magic happens when we collaborate with clear role and mutual respect. That's why today we have so many actually interagency platform. In Africa, we have one that is really vibrant, and we met every month because we have so many actually challenges that we are working together, and we have one for program, UNICEF, WHO, all in the same room every month discussing and seeking these complementarities. Thank you.
Yeah, thank you. So interesting. And wow, we've already come to our last question. That's surprising to me. This went so quickly, so interesting. But this is a question about advice and reflection. So, looking back at your own path from pharmacy to global health systems, what advice would you give students who want to work at the interface of technical expertise or supply chain management, public health leadership, the way that these all combine based on your own personal journey?
Awesome. When I was studying actually pharmacy in Senegal back then, so people had the idea that a pharmacist is just made to be just behind the counter, dispensing medicine, advising, following on pharmacovigilance. And then later on, myself, I specialize in biology. So, or you will be in a lab to running actually all these medical and biological tests. But one thing I will say is you need to stay curious and don't box yourself in. Even people who tend to box you in, don't box yourself. Things over. When I started to work on public health, there were not many pharmacists actually in that field, to be honest. And till now, actually, even students tend to come to me and ask me how to actually to learn in that field. My path wasn't linear. It wasn't linear at all. I moved from pharmacy to supply chain to public health leadership, and each step actually taught me something new. You need technical deep, first of all, yes, but also system thinking and also empathy. Spend time in the field. You need to learn from the ground. You need to be in contact with actually your end user and to really understand the solution itself. And it grounds your understanding of what really works. And never forget why you started. Every data set, every strategy, every meeting ultimately connects back to a person waiting for care. Keeping that focus, that human focus, I would say, gives meaning to everything we do, because as a final outcome will benefit to people. I had worked on several projects today. I had worked on introduction of carbetocin in countries here, and every time that we are gaining point on maternal mortality, that we are saying that it is improving now. Women have early access to that care. I'm really proud because I know that our work on oxytocin, on carbetocin contribute to that, and at every step you can be proud of yourself. Thank you.
Yeah. I was thinking while you were talking, this is about global health, but you could apply the same concepts to any level of public health. You can
True.
apply this as well locally, wherever you are. It doesn't have to be thinking about a different country or the other side of the
True.
world. If you want to improve health in your community, you have to know what's really going on with people, talk to
True.
people. Don't let yourself be boxed in by a title or
True.
the title of the major you studied. So you're the
Definitely.
perfect example of that.
Exactly.
Yeah, I'm very
Thank you,
inspired.
Liza.
Yeah. Okay, thank you so much for your time, Aissatou.
Thank you. No, thank you so much to you for this opportunity. It was really amazing for me to share my experience on that. And I hope that we'll have more platform for it. Thank you so much, Larissa.
Thank you.
Thank you.